Hi students, I'm Dr. Bhavana. In this lecture, we are going to continue with the topic called as human health and diseases. So in the last class, we have dealt in human health and diseases about the different types of what are the lymphoid organs which are associated with the immune system, as well as we have dealt about the topic called as AIDS. So what are the primary lymphoid organs and secondary lymphoid organs we have already discussed. Only important neat question that you should remember related to what are the organs which are associated with that of immune system is nothing but primary lymphoid organs they are associated. Primary are bone marrow and thymus. Only two you should remember. Bone marrow and thymus are for primary lymphoid organs. Rest all are secondary lymphoid organs. So I want you to get a clear differentiation based on this. Only two to remember in primary, then three to remember in that spleen, lymph nodes and all are secondary lymphoid organs. So what is the role of primary lymphoid organs? So the role of primary lymphoid organs, it is nothing but primary lymphoid organs, they usually have origin and maturation of lymphocytes will take place. Where origin and maturation, where these lymphocytes will go and act, it is nothing but secondary lymphoid organs. So primary lymphoid, then it comes to secondary lymphoid organs. Bone marrow, thymus. Bone marrow is help in production of RBC, WBC and nodes. And thymus, it is located near the heart. It is very large in size and it reduces its size during the age of puberty. So that is done about that. Then secondary lymphoid organs, we know lymph nodes are present everywhere in our body and these only help in trapping the microorganisms, as well as spleen is the graveyard of RBCs. So that also we know, and it also help in trapping the microorganisms. So these are the important NEET questions which are asked. And another important NEET question that is related to that is nothing but MALT. MALT is nothing but mucosa associated lymphoid tissue. Mucosa associated lymphoid tissue means what? Along with the mucosal lining. Where is this mucosal lining present? I told you in the innate immunity in the physical barriers. Mucosal lining is usually present in respiratory tract, urinogenital tract, as well as the third is digestive tract. Digestive, respiratory and urinogenital tract. These three are present. Then later this mucosal lining, when it is associated with that of lymphoid tissue, when it is associated with that, then this is called as mucosa associated lymphoid tissue. Means lymph nodes are present everywhere. Like that lymphoid tissue also plays an important role. How it plays an important role in trapping the microorganisms. Alone the mucosal lining of the respiratory tract and digestive tract can't play an important role. So that's why it is associated with that of mucosa is associated with that of lymphoid tissue, also called as MALT, mucosa associated lymphoid tissue. So it is associated with that and it prevents the entry of all the foreign particles. About 50% of the lymphoid tissue. In lymphoid tissue only, these T lymphocytes and all are present to protect against the foreign particles. So about 50% of the lymphoid tissue is mostly contributing to that of this mucosal lining of respiratory, digestive and urinogenital tract. So that is done. Next one we have gone to the topic called as AIDS. So AIDS, we all know AIDS was discovered in 1981. Important neat question. When it was discovered in 1981 in one person and it spread rapidly, very fast. And which is the disease where there is no cure for the disease? One is cancer. In extreme stages, cancer, there is no cure. As well as AIDS is the most fatal disease and there is no cure for this disease. Then how to cure this disease? There is no cure, only prevention is the cure. So what are the modes of transmission of AIDS? It is transmitted basically by infected needles, blood products and all, and from mother to baby during sexual contact. All these will play an important role in transmission of AIDS. So AIDS only by name only we can understand. It is acquired immunodeficiency syndrome. This is the immune system. It is weakening the immune system, and it is acquired from others. Naturally, you won't get this disease. And the important point that you should remember is it is not spread by just physical touching each other or everything. It is not usually spread. It is only spread through infected needles or through only body fluids it will spread. Not through, it will not spread through direct contact. It will spread through only body fluids. So that point you should keep in mind, as well as what is the virus which will cause AIDS. HIV is the virus which will cause AIDS. Here also name human immunodeficiency virus. It will suppress the immune system and cause the disease. So it is HIV. So human immunodeficiency virus. The first virus is that of AIDS. Next is HIV. So this HIV belongs to a group of viruses that is called as retrovirus. Rhinovirus is different, that will cause common cold. Retrovirus is different, which will cause AIDS. So that is about the what are those which help in transmission of disease and what are virus which cause. And the important point you should remember, everyone will think that HIV or AIDS is caused by DNA virus, but that is the wrong concept. It is caused by RNA virus. So RNA, it will first will get introduced into the cells. I'll tell you the mechanism, but for now you remember RNA plays a very important role. And what are the tests you perform to detect AIDS? ELISA as well as Western blot test. Important Neet question. ELISA is the test which is performed to detect what type of viruses, like RNA virus, and it is nothing but HIV. ELISA, Western blot test. Important to be remembered. And the lifespan of the person can be prolonged by using antiretroviral drugs. Antiretroviral drugs. How this name came like antiretroviral drugs? Normally retroviral drugs means what? It is caused by retrovirus, right? So that's why antiretroviral drugs means they are acting against the retrovirus, but these can't prevent the person from dying, but it can only prolong the lifespan of the person. The person's lifespan can be prolonged. And there is also important question that you should remember. It is nothing but about the incubation period. So what is the incubation period basically? The time of infection. First the person will see with the infection, and then later stages he will develop with appearance of symptoms. Symptoms he will see in the later stages. First the disease will be seen, and later he will be detected appearance of symptoms. Between these two periods, the time lag between the infection as well as appearance of symptoms is called as incubation period. And what is the usual lifespan? It usually lasts for about few months to years. Almost it takes 5 to 10 years for a person to understand that he was suffering from HIV, and those symptoms also will not appear very fastly. After 5 to 10 years, slowly he'll get this symptoms. What are the symptoms which are associated? All the dangerous symptoms or whatever symptoms are there, everything will be seen in the patient, AIDS patient. Like what are the symptoms? Mostly he'll see fever, full weight loss will be there, anemia, loss of appetite, and whatever the bacterial diseases, whatever the viral diseases, fungal diseases, everything will be seen in this person. Because totally it will suppress the immune system like anything. This virus will suppress the immune system and it will cause numerous what we say diseases like all bacteria, tuberculosis, full our immune system, our T lymphocytes, which will play an important role in the immune system. Everything will be destroyed and you are susceptible to so many types of infections. All type of infections will be seen in the patient who is suffering from AIDS. So that's why what is the prevention measures like blood transfusion and all should be very healthy. Blood should be taken from the donors, as well as infected needles should not be shared among the persons, and as well as see you should from mother to fetus also the mother should take some precautions to prevent for the child to attain this disease. Like before only she should know that she is suffering from this, and this disease is not like it should be socialized for every person, because few persons don't knowing also they will not say that they are suffering from AIDS. That's why we should be very careful in these aspects, as well as promote the good like social well-being of the person should be maintained for this. So basically which organizations are taking care of this AIDS? So NACO, that is National AIDS Control Organization, is taking care of this. Then what is the mechanism of this virus? Basically, I told you it is a RNA and it is a virus. So viral RNA will enter into the first, simple to remember, don't get confused. First it is macrophages, it will enter the macrophages. Then it is transformed into viral DNA. RNA, if it is transferred into DNA, one enzyme will act. That is nothing but a reverse transcriptase. Reverse transcriptase. So when viral RNA is entering into viral DNA, reverse transcriptase enzyme will act, and it is mostly done in macrophages. So this viral DNA will enter our host DNA, means it will enter the human's DNA, and there it will start replicating. It will produce numerous virus infected cells. How it will produce numerous virus infected cells? By again transforming into, see, this DNA will enter the original DNA and it will damage the original DNA and it will produce again RNA, and this RNA will produce numerous infected cells. It will produce numerous infected cells, it will produce, and again this will give rise to numerous infected cells will be present. And these infected cells will attack the T lymphocytes. T lymphocytes. When these attack the T lymphocytes, all the T lymphocytes will get reduced in number. This all will take place in the, I told you, incubation period, that is time lapse between the starting point as well as appearance of between infection and appearance of AIDS symptoms. This will take place, this full chart will take place in these 5 to 10 years. So basically viral RNA into viral DNA, reverse transcriptase takes place in the macrophages. Then again it is transformed into DNA, DNA is transformed into RNA, and it will give rise to numerous infected cells. These numerous infected cells, these will damage the T lymphocytes. First one to be damaged is macrophages, second one is host DNA, third one is T lymphocytes. Remember in this order for easy remembrance. See, macrophages, this one, what we say, DNA as well as T lymphocytes, these three. This cycle should be remembered properly. So this is about the AIDS. So the NACO and all are taking precautionary measures, but people should educate, we doctors should educate the numerous people regarding this concept, and because it's a rapidly spread disease and over 25 million people have died due to this disease. So this disease should be prevented from reaching others, as well as all the precautionary measures should be done. Prevention is better than cure for the disease. So preventionary measures should be taken properly. So next we are going to deal with another disease that is called as cancer. Cancer. So cancer is also the most common. Cancer is also the most common deadly disease in this world. So many people were killed after AIDS. Cancer also, same numerous people were killed due to this cancer, and it is the most deadly disease of human beings. Mostly it is spread all over the country. So firstly, what is the modes of transmission of this cancer? So mostly these cancer are caused by basically three types. They are nothing but physical agents, chemical agents, as well as biological agents. Physical agents, chemical agents, as well as biological agents. So cancer is mostly caused by physical, chemical and biological agents. What are the physical agents generally? It may be ionizing radiation or non-ionizing radiation. When we are exposed to that of radiation for so many times, that's why suppose if you want to take a X-ray also, so many times you should not get exposed to that because it may cause cancer. X-rays are very harmful. So that's why this cancer, it is, you should not get exposed more to X-rays unless it is necessary. But nowadays diagnostic centers and all, X-rays are very important to diagnose a disease. Very frequently we should not get exposed to that of X-rays. So basically physical agents, chemical agents as well as biological agents. When we come to physical, ionizing and non-ionizing radiations. These are radiations. Ionizing means what? X-rays as well as gamma rays may cause cancer. X-rays and gamma rays will cause in ionizing radiation. When it comes to non-ionizing radiation, it is UV rays. When you are exposed to ultraviolet rays, for as ozone is present, so there is no harm. But if ozone is depleted and all, the UV rays, we are getting exposed to UV rays, and it will damage the humans basically. So basically in the physical agents which will cause the cancer, it is ionizing as well as non-ionizing radiation, X-rays, gamma rays and UV rays. When it comes to chemical agents, what will cause chemical? We already have seen the lung cancers and all, we all know. Why it is caused? It is caused due to tobacco smoking. Tobacco smoking, severe tobacco smoking may cause the smoke which is released. These cause the cancer. Which type of cancer they will cause? They will cause lung cancer. There are many types of cancers like lung cancer, prostate cancer, all different types of cancers are present. Duodenal cancer also is present. So those are the different types of cancers. Everywhere if a tumor is formed, then you can say it as a cancer. So these are the chemical agents which cause the cancer. Next, what are the biological agents? There are viruses which are associated with that of cancer also. They are called as oncogenic viruses. Oncogenic viruses. Oncogenic viruses, or you can say as viral oncogenes also. Anything, oncogenic viruses or viral oncogenes, as well as cellular oncogenes or proto-oncogenes are also the cell changes which we see when we are met with cancer. That is cellular oncogenes, or proto-oncogenes. Cellular cellular oncogenes or proto-oncogenes also will cause cancer. So this is about the what is the agents which cause the cancer. Basically, don't get so much confused. It may be only three types: physical, chemical, as well as biological. Physical means all the ionizing as well as non-ionizing radiations. Ionizing X-rays, gamma rays, non-ionizing UV rays. When it comes to chemical agents, it is tobacco smoking. When you come to biological agents, it is nothing but oncogenic viruses. So cellular oncogenes or proto-oncogenes. Cellular oncogenes or proto-oncogenes will cause this virus. And these are caused by these biological agents. So cellular or proto-oncogenes are the changes which are made when you are met with the cancer in the cells. So this is about the what are the type which cause cancer. Next, we all know that this cancer, see, for us in our human body, cell differentiation as well as cell growth is very much controlled and limited. Cell differentiation as well as cell growth. Cell growth and differentiation means what? Cells will not divide. Very frequently cells will not divide, as well as cell growth also is very much controlled in our body in normal cases. But when you are met with the cancer, the cells will proliferate very rapidly. Cell growth will take place, as well as full differentiation of cells will take place. Numerous cells are formed. Normal cells in our body, normal cells, they show a property. Normal cells show a property that is called as contact inhibition. Contact inhibition means what? Suppose these are the cells in our human body. These are the cells, they will show contact inhibition. Means they will not contact each other, normal cells. But when you come to cancerous cells, they lose this property of contact inhibition and they will form like this. What is this called? They lose the property of contact inhibition and they proliferate very rapidly and form a tumor. So this tumor only results in cancer. And again tumor is classified into two types. That is nothing but benign as well as malignant tumor. Benign, malignant tumor. Benign tumor means what? The growth of the tumor is very much small and it is very limited to that place and it will not spread rapidly. It is not so much harmful. Simple tumor, it can be cured. But when it comes to malignant tumor, this is very large in size and it will not stay at one place. It will start rapidly spreading from one place to another. This property of malignant tumors, which help in spreading to different parts of the body, is called as metastasis. Metastasis. So basically, the cell, what we have discussed till now. So cell growth and differentiation in our body is basically control mechanism. And the normal cells show a property that is called as contact inhibition. Means there will be no contact with each other for the cells. But when the cancer, you are attacked with the cancer by some physical, chemical or biological agents, then these all will lose the property of contact inhibition, the infected cells, and they will come close to each other and form a tumor. And they form two types of tumors, that is nothing but benign and malignant. Benign tumors, they are very small in size and they are restricted to that place and they will not spread along each other. These are benign tumors. and they are very not so much harmful. But when it comes to malignant tumors, they are very large in size and they spread rapidly to the surrounding tissue. They invade the surrounding tissue. Here, when you come to benign tumors, they will destroy only that particular type of tissue. Rest of the tissue will be normal. But when it comes to malignant tumor, full tissue will be destroyed. And this property of destruction or invading the surrounding tissue is also called as metastasis. So that we have discussed. So this is the another property. So till now what we have discussed in cancer, what are the modes of transmission as well as how it is spread from one person to another. Later we will see so what are the tests you usually perform tests to detect the cancer. Numerous tests are seen like biopsy, histopathology, then CT, MRI, molecular biology. These are the most common tests which are usually performed to detect that of cancer. Biopsy means what? Simply, if a person is suffering from a tumor or something, then you will slice the tissue and you will stain it, slicing and staining the tissue, and then you will observe under microscope. You will stain the tissue and you can identify which cells are normal cells and which have lost the inhibition property, and then you are able to detect that of cancer. For histopathology also same. The pathology you will see of the tissue. Histopathology under microscope you will see basically. You will detect the type of tissue, you will slice it, then you will take it and stain it and observe under microscope. Same procedure is followed for biopsy as well as histopathologic sections. When you come to CT scan, CT scan is computed tomography. So CT scan is very costly. MRI and CT are very costly to that of normal people. But the use of this is, see, CT scan, MRI is usually all the magnetic fields. It will surround the magnetic fields and help in easy diagnosing of tumor in MRI. It will work on the principle of magnetic fields. When it comes to CT scan or some X-rays, you see all the three-dimensional figure you can get, the three-dimensional image. So it is easy to identify whether a person is suffering from cancer or no for CT as well as MRI. Then what is molecular biology? Molecular biology means suppose antibodies, some antibodies are produced to detect the cancer specific antigens. Normally in our body antibodies are produced to protect against diseases. Antibodies here are created artificially and they are sent into the body. If cancer is there, these will act and the doctors will know that the patient is suffering. If the cancer is not there, antibodies are not present and antibodies will just act like that. So the person is diagnosed as negative. So these are the tests which you will do to diagnose the cancer. What are the four types of tests? Biopsy, histopathology. Simply take the sections and observe under microscope with the staining. Then CTs or X-rays, three-dimensional of the, you see of the tumor, you can see three-dimensional structure in CT. When it comes to MRI scan, magnetic resonance imaging, then you can see all the magnetic fields which are associated with that of cancer. And then molecular biology. I told you antibodies are produced against the cancer specific antigens. Antibodies are produced and then you can easily identify whether the person is suffering or not. So these are the tests. For AIDS it is ELISA. For cancer these are all the tests. Then when you come to treatment which is associated with that, what are the treatments which are associated? For cancer, there is cure actually. For AIDS, there is no cure, but cancer, until later stages, there is cure. Normally, if you diagnose in the initial stages, cure is present. So, treatments. What are the treatments which are associated with that of cancer? They are nothing but surgery, radiotherapy, as well as chemotherapy. If you follow these three therapies, you can easily make the person alive and he can lose that of cancer. See, surgery, radiotherapy, as well as chemotherapy. Surgery is generally performed in very huge cases. If the person is suffering from any lymph nodes cancer and all, the surgery is undertaken for that person. When it comes to radiotherapy, again radiation is sent to the body, full radiation, and the person that tumor will die due to that of radiation, and then the person will be alive. But radiotherapy, what are the diseffects which are associated with radiotherapy and chemotherapy are nothing but hair loss will be there, as well as anemia will be there. Severe hair loss will be there for those persons who are suffering from cancer, as well as there will be loss of appetite and weakness, anemia also the person will be suffering. When it comes to chemotherapy, chemotherapeutic drugs are used, and for radiotherapy it is radiation. Surgery is for smaller cases, biopsy is done. For larger cases, either removing the tumor or you can say removing that tissue totally will come into play. So this is about the three different types of treatment. And in severe cases, it is also treated with alpha interferon. Alpha interferon drug will also help in diagnosing the cancer as well as for the treatment of the cancer. So these are the three procedures which are followed for the treatment of cancer. That is nothing but surgery, radiotherapy as well as chemotherapy. Surgery, small cases biopsy, large cases or heavy surgeries performed, the removing the total tissue and all. Radiotherapy, severe radiation is given to the patient. When it comes to chemotherapy, numerous chemotherapeutic drugs like immunosuppressants and all will be present to cure the person who is suffering from cancer. Later stages, alpha interferon is also given to prevent and for the treatment of cancer. But what are the side effects which are associated with that of radiotherapy and chemotherapy is nothing but hair loss and loss of appetite. What are the symptoms you see for cancer? You all know. For different types of cancer, there are different symptoms. So no, for lung cancer, like you can see breathlessness and all. For different types of cancer, there will be different types of treatment as well as symptoms. So this is about the topic called as cancer. In the next class, we will see about the drugs and its side effects. Okay.